In terms of the response, our colleagues in PAHO are providing direct assistance to the government, to many of the states that are badly affected, including Amazonas. In a sense, South America has become a new epicenter for the disease. We've seen many South American countries with increasing numbers of cases, and clearly there's a concern across many of those countries, but certainly the most affected is Brazil at this point. We also note that the government of Brazil has approved the use of hydroxychloroquine for broader use, but we do point to the fact that our current clinical and systematic reviews carried out by the Pan American Health Organization and the current clinical evidence does not support the widespread use of hydroxychloroquine for the treatment of COVID-19, not until the trials are completed and we have clear results.
I'd also like to point out something that Mike touched upon is the disproportionate risk that we see of vulnerable populations for COVID-19. We're seeing this across a large number of countries. All countries have vulnerable populations, and we are seeing a greater impact in terms of disease severity, poor outcomes in groups that are vulnerable. And a lot of this has to do with underlying conditions in these groups, access to care. It highlights the inequalities that we see in vulnerable groups. And I want to highlight that there are vulnerable groups in every country. And so we need to work even harder to ensure that all people have access to health care, that all people have access to testing, to information, and so that we could prevent as many severe infections and deaths as possible.